Hey guys, this is pharmacist Curtis Alexander. In this video, I'm going to be talking about Saxenda, which is a weight loss medication. I'll be going over some of the common questions that I get. Speaking of weight loss, make sure you go to curtis-alexander.com. I have a free report. It basically goes over natural ways that you can improve your health, including losing weight. So let's hop right into it. So Saxenda is a GLP-1 inhibitor. It's a glucagon-like peptide. And what does that mean? So when something is a glucagon-like peptide, it acts like it. What we see is an increase in insulin, decrease in glucagon, increase in beta cells, and the end result is that you're slowing gastric emptying and ultimately you're decreasing food intake. Okay, I also want to note that we do see a decrease, a slight decrease, not huge, but about a 1% decrease in the hemoglobin A1C, which is important if you're diabetic. Next question we get is, how effective is it? In studies, what they saw is that compared to placebo or people who were taking just a fake injection, there was 3 to 4% more weight loss versus the placebo. The goal when you take Saxenda is that if you weigh 200 pounds, that we see a 5% weight loss over a 12-week period. So 10 pounds is what that works out to give you an idea of the kind of weight loss that you're shooting for if you're going to take it. As far as side effects, it does come with some side effects, and the most notable is going to be nausea. 38 to 42%. We can see an increase in heart rate, and this range we have here is because of the variance in dosing. So the higher the dose, the more you're going to see in the increased heart rate. We can see low blood sugars or hypoglycemia. On people who were taking Saxenda just by itself and they were diabetic, they saw 13% incidence in hypoglycemia. If they were taking something like a sulfonylurea, which is a fairly common diabetes medication, the risk of hypoglycemia was much higher, almost double, or actually a little above double. So we also see diarrhea at 22% and finally headache. So those are your kind of common side effects that we can see. People will sometimes ask, do you have to avoid certain foods? That is not the case. As far as dosing, what you're going to see, the downside of Saxenda is it's a daily subcutaneous injection. So that can be kind of problematic for some people who don't want to do that. But we'll start out at 0.6 milligrams sub-Q once a day, and that eventually titrates up. And what we want to see is you up to 3 milligrams a day. The studies really don't show any benefit less than 3 milligrams a day. What some doctors will do, if you're titrating up and you can't tolerate the 3 milligrams a day, they may keep you on it because some people say there is benefit to it, but I'm just saying the studies, the 3 milligrams is kind of the mark you want to hit. The studies show that there's not a ton of benefit below that, but other doctors will have you continue to take it. Okay, now there are some warnings that you need to know about, and warnings essentially are maybe not a common side effect, but there are things that you need to know about, groups of people that need to be really careful taking it, okay? So number one, poor kidney function. If you have that, you want to be careful. If you have any sort of gallbladder disease, GI symptoms can crop up and be problematic for people with stomach issues. If you try to accelerate that dose titration, if you're trying to go up faster, then maybe what you should, you're going to see a lot of the GI side effects like the nausea we were talking about. This is an interesting one. Thyroid C-cell tumors. They did find in animal studies that there's an increase in this, but I want to point out that humans don't actually have that many C cells. So this hasn't really been borne out in people, but it's important for you to know that if you have any sort of thyroid issues, keep an eye on that. And then pancreatitis is another group of people that we want to be careful in. Okay, so once you start it, how long should you stay on it? And you're going to find differing opinions on how long you should stay on it. Normally we're shooting for 12 to 16 weeks. To me, what I read in the studies, so on and so forth, the longer you're on it, the more you're going to increase your risk of side effects. That's obviously a call between you and your doctor, but me personally, I would want to be on it short term rather than long term. They did see people who were on it 26 weeks start to have issues with their gallbladder, okay? And another common question, if you stop this, is there going to be weight gain? This is mixed. In my experience, people do get weight gain. One of the things you have to understand is we see people who take drugs like Saxenda is their doses have to keep going up and up because their GLP-1, they essentially become, in a way, sort of immune to it. I mean, their bodies see so much of it that they don't respond the way they used to. Their receptors are becoming resistant. Some people will tell you that's not happening. I'm just telling you what you see in the real world, which is these doses continue to escalate. So I don't like to see it long term, which brings us back to the weight gain. I do see weight gain in people when they stop it. I see that reported to me. Some of the studies were mixed, but I think from a practical perspective, you need to understand that it is a real risk factor. And another reason, in my opinion, I prefer to see it used on a short-term basis. Hair loss, there wasn't really any noted, so I don't think that's a big deal. I mentioned earlier, are there other issues with doing this? It's a daily injection that becomes problematic for people when they inject in that abdomen area. It gets old, having to inject in that area and rotate. So it's kind of a pain that way. And then, you know, a couple of random concerns. We talked about thyroid, congestive heart failure, and insurance. It is not a cheap medication. A lot of insurances maybe don't cover it, or you have to jump through a bunch of hoops to cover it. So it's certainly not cheap. There can be problems that way. So that's kind of a broad overview, some of the more common questions that I get about Saxenda. Do me a favor, if you've taken it, you know somebody who has, drop a line in the comments. Let me know, was there side effects? How did it work for you? In my experience, it does help with weight loss, but there's problems with it, and it tends to be something I don't like to see people on long term, but that's just, you know, an observation on my part. So let me know in the comments if you've taken it. It's helpful for me, and it's helpful for other people that watch the video. Speaking of helpful, I hope this video was, and I will see you in the next one. Thanks.